Hello, everyone. As you may have noticed, Burst has been going through a series we're calling The Journey to Motherhood. We are here today to talk about the link between oral health and postpartum. My name is Kelly Small. I'm the Director of Brand Management for Hygiene at Burst, mother to my 15-month-old son, and still processing the swings with my own personal postpartum journey. We are going to talk through some dirty details, give some of our personal experiences, and hopefully have some helpful tips and tricks to pass on to you.
My name is Summer. I'm a dental hygienist and a Burst ambassador. I am a mother of three children. I'm currently practicing in Los Angeles, California, in clinical practice. I work 4 days a week and I juggle my family full time as well.
Yeah, it's a lot. Well, thank
It
you.
is.
Lena, would you mind introducing yourself?
Hi, everyone. I'm Lena Suarez-Angelino. I'm a licensed clinical social worker, a mental health and wellness coach and consultant for companies, schools, and nonprofits. I am a mother to a toddler with special needs. He'll turn 5 in July, and I have also a stepdaughter who is 16. So lots of different hats and things to juggle there too.
Yeah, you both are balancing a lot. So let's get into it. And thank you again for taking the time to chat with me today. What was or is your postpartum experience like? Was it anything like you expected?
So for me, no, it wasn't. I just thought it would be a lot easier and smoother, but you get thrown curveballs with children and new experiences, especially with having C-section. After having the baby, you can't really be as hands-on, so you have to ask for help and be dependent on other people, which is something that I'm normally not used to. Um, it's a struggle, and things change. You just have to deal with adapting to the changes, and more than you would like to, and in adjusting and finding ways to make things work.
Absolutely. Absolutely.
I,
Lena, what was your
I
experience like?
returned about the same time, entering into my fourth month of postpartum. I had an induction, so or like my son, I was induced, and I wasn't really prepared for that. I wasn't prepared for I was open to whatever needed to happen during birth, but postpartum, like I didn't start to feel anxious. I didn't start to feel nervous until it was time to go back to work, right? And it was like, how am I going to care about everyone else's problems and listen to, the spectrum of things that I personally didn't feel were as traumatic as me having to care for a newborn at home and worry about him. And then now in the toddler stage, it's with his special needs, like no one prepares you for that, right? No one prepares you for what does that look like. And so I'm grateful for having the support, and similar to what Summer had said, being able to really learn how to ask for help, and trusting that people are here to help you, and not it's not a what do I want to say, like a I do this for you, so you have to do something for me type of thing.
Mhm.
um you know
Mhm.
really, and I'm grateful to have a partner that it doesn't feel that way, and I feel fully supported. So
Yeah. So that is huge. Yeah, I feel like there is a level of empathy after becoming a mom that you unlock. You're like, how did you do this? Like, how did you balance all these things? How did you manage to do that? And that's great that you have a supportive partner. But again, going through the stages of motherhood was like one of the biggest learning experiences in my life. So, yeah, just what society expects of you, what you expect of you, and then the reality of like what your body and your family needs and your baby needs and things like that. So I think that there's also different stages. Like those first 3 months before you go back to work, to your point, are absolutely wild. I don't know how people function on that much sleep. Also, they talk about the postpartum glow, more like postpartum BO. I didn't know I was going to feel like that, like my body and my hormones and all of that. I felt like, you know, the levels of caring for myself were different. So, what did caring for yourself look like at that time?
So for me, it was everything felt rushed. I had to like figure out, okay, is this the perfect time to run and do this? The baby, I just put him down, or and you're just squeezing a lot of time in. So I found that, you know, it my routine wasn't the same as what I was used to. I had to, you know, brush my teeth when I got the chance as soon as I could, or maybe it took a little less time because I had to run and do something else. And, you know, so it changed a lot, but I reminded myself that it was only temporary, and I tried not to be too hard about it, on myself about it. So, um, but it's not an easy adjustment. So you got to try to find shortcuts and things that work that can help you manage your self-care.
Mhm.
With us, it was, we were kind of having, I thought I was rocking the breastfeeding thing. Like first day home with the baby, like he latched, I thought he was doing great. And then he was just starving. And, it turns out that he wasn't actually latching. He wasn't actually, emptying my breast the way that he, was supposed to. And so, kind
Yeah.
of deciphering between, breastfeeding formula and just, you know, understanding, like there's so much pressure, right, as what you were saying before, Kelly, of the societal pressure, right? And so just kind of what are those expectations, and my partner again really helped to kind of help me let go of those expectations of what I
Mm.
envisioned motherhood to be. And then even still, right, those daily, that to Summer's point of, the daily routines of brushing our teeth, it's, whenever you could, whenever you had a moment, and showering. And I was really grateful to have connected with a bunch of moms, but I didn't realize that they were stay-at-home moms, right? Like, or not that that's not a wrong thing, but when I went back to work, I felt like I lost my friends because I could get together with
Mm.
them at Wednesday at 11 a.m., but not when I went back to work, right? So then that kind of like
Um,
level of connection, felt like it was harder to stay connected to them. So that was definitely
Mhm.
a
Mhm.
transition.
Something, Lena, you said that really soaked with me was like, it's okay to soak up those slow moments and take a moment to like be like, this is okay. You don't have to have something on your to-do list. And I mean, just based on our conversations, I feel like we're very similar in the ways that we're like, all right, we got to do this and this and this. And I think a lot of moms will resonate with that, is like, you're keeping the household running in a lot of different ways. And thankfully you have, partners who are helpful in a lot of different ways, but it's okay to not have something to
Mhm.
do. And then it's also, Summer, to your point, it's okay to have boundaries. It's okay to say, I'm going to go brush my teeth. I'm going to go take a shower. Like, if you have a supportive team to be able to do that. And again, we are very privileged to be able to do that. But like, I think there's this, I don't know if it's mom guilt or if it's things like that where you're like, I can't leave my baby. My baby needs me. And it's like, well, yes, but you also need to be the best version of you to be able to care for your baby. And I think there's also these, not only emotional, not only are you sleepless, are you overwhelmed, are you dealing with how to change with all this shift? There's all these raging hormones that are happening too. Your body and your lifestyle changes that are happening can impact your oral health and can impact, your routine and how you're taking care of yourself and in particular your mouth. So specifically thinking about that, how do you think stress, or how do you know how stress and depression, in a sense, can manifest in the body?
so with oral health, being stressed out, number one, causes you to have a dry mouth if you're nervous. So you
Mhm.
your dry mouth and salivary flow, it doesn't help you. She takes a sip of her water.
I feel good. I feel
Um,
good.
Yeah, yeah.
it doesn't help you. Your mouth naturally take care of what it needs to help with, neutralizing the acid, helping keep your mouth clean. So
Mm,
you want to always, drink water. Think of foods and, that you can have that, help increase the health of your mouth, since you're on the mode where you're just trying to survive and get through your day. So water, eating foods like, cheese, like hard cheeses like cheddar, they help increase salivary flow, which, promotes, the good bacteria in your mouth.
adding it to
Help
my list. Great. Check, check.
It helps strengthen your tooth enamel. Same with dark chocolate. Dark chocolate strengthens tooth enamel. It also, increases your serotonin level, so that helps with the stress and the depression part.
Mhm.
Um, so, eating chocolate is actually a good thing for the mouth. You also want to, we're always in a rush and all of that. So you want to make sure that the snacks that you're grabbing are maybe crunchier things like, carrots or apples, something that's going to help clean your mouth while you're chewing, till you get around to doing what you need to do with your home care and your brushing and your flossing. And don't be afraid to get away from your routine, that you're used to. You can do a shortcut, use floss picks, or something else that's
I love my
you
water
know
flosser. Like I absolutely love it.
mm,
I get to do it in the shower. It's super convenient.
yeah.
It adds.
Yeah, there it's amazing. There's different ways to help yourself while you're not doing what you're used to, until you adjust and adapt to your new situation, your happy,
Mhm.
healthy baby, or your changed life.
Yeah, stimulating the gum flow in effective ways because your
Yeah.
brain isn't there. That's amazing. And thinking about the symptoms of stress and clenching and holding on to all of our stress and not sleeping and feeling restlessness and kind of over that. How does that manifest in the body, Lena? Do you feel like the people that you speak with talk about that? Have you experienced that
I've
yourself?
definitely experienced it myself, and then especially the moms that I work with, they talk a lot about that, and that's because we hold all of that tension, right? We hold it, and with our heads are so heavy, so when we go to sleep, and if we're not moving because we're so exhausted, we don't, you add all that pressure too. So just kind of taking moments, just becoming more mindful into your body, right? There's a lot of when we're stressed, when we're feeling depressed, there's a lot of dissociation that can happen, and lack of awareness in our bodies. And so becoming more mindful of, where am I placing my tongue throughout the day? Am I clenching my breath, right? Or clenching my jaw, and then using your breath to release some of that. I a lot of the times will guide clients through a progressive muscle relaxation. And so it's really just going head to toe, from tightening your muscles on an inhale and then exhaling, right? And just allowing that calm to rush over your body. And so you can do that just in your face, in your hands and your feet. And so it really helps them to realize, oh, I've been, clenching my shoulders up, right? Maybe it's not, of course I'm
Mm.
exaggerating right now, but it's like, oh, okay. And again, with loosening the jaw, right? And massaging it.
Yeah. Even
Sometimes I tell my patients that I could tell have clenching and grinding going on, to consciously separate their teeth and keep their lips closed. If you do that,
hmm,
it
Try.
releases the stress in your jaw.
doing that.
Yeah. So yeah, just it's kind of like lifting your teeth like you're about to talk, but closing your lips. And that takes away some of the tension. Also, just quick breathing, and then neck and muscle exercises. I do that in the middle of my day sometimes because it gets tense and you're just rushing, and it really helps to just breathe and do some, because we tend to carry our tension in our neck and shoulders. At
Hmm.
least I do. So that helps me a lot.
Even just like, I don't know if y'all felt this way, but the way of holding your baby and like your neck and constantly looking down and like all of the neck and the head and the shoulders and the body and then how that actually manifests into your mouth and where you're holding the tension is so interesting. And you know the idea of holding so much tension here is pretty wild because you don't, it's not like it's saying anything to you, it's just you're there, you're holding it. So that are really great tips, and I'm gonna start to apply them into my daily routine and everything. So thank you for that. And even with like the sleepless nights too, insomnia and restlessness, how can that like impact your mouth and your oral cavities?
So obviously sleep is important for our overall health, but in general, stress and not sleeping is hard on the body, and it actually causes even the littlest bit of bacteria or dry mouth, and the reaction our body has to stress can actually cause you to have gingivitis like a lot easier or faster. So you just got to focus on reminding yourself, okay, I need to care for myself. I take like melatonin or something that's going to help you sleep. Stay away from the screen, because I know that
Yeah.
we want to get distracted from our minds that are constantly going because of all the things that we have. But that helps maybe allow you to fall asleep. But as far as the mouth is concerned, um, you want to just you know stay hydrated, drink lots of water. I keep water next to me even at night. to just help in any way to reduce the bacteria and effects of that on my teeth and gums.
I was just thinking back to me and my like really deep postpartum phase where I had like a basket of snacks and a water bottle next to my bed. And I was just sitting there literally looking at my screen at like 2 a.m. and being like, what is happening? So, mental note for next time or for friends being like, in that basket, you should have carrots and dark chocolate and cheese and a big old glass of water. So, all right,
Right.
check. All right, great. Um, do you have any advice on how to advocate for yourself and your needs? I mean, we've talked about us doing this, having our partners and things like that, but do you have any advice on how someone can advocate for themselves or what they need during that time?
I I think being able
Go.
to track, especially if you're wanting to talk to a doctor about something, right? Doctors are they tend to want to see data, right? They want to see evidence. So even if you have energy to jot down your mood swings, right? And saying, this is what's happening, every time at 2 o'clock, that I get really anxious, I get really upset, get really worried, right? So keeping a little bit of but don't make it super extensive, right? We've already got a lot. We've already, we can't manage much because we're managing a newborn. But just being able to say like, look, this is what's happening, right? This is what I'm experiencing. This is how often I'm experiencing it. This is why I think that this needs attention, right? And so if that's whether you're going to your primary care doctor, a psychiatrist, even talking to a mental health therapist, being able to say, hey, this is what I'm really struggling with, and just being
Mhm.
kinder to yourself, right? So the moment that you catch that it's out of routine, it's out of your daily habits, just being kinder to yourself and say, I'm still adjusting. I'm still adjusting to this new phase of life.
Do you feel, just to add on to that, do you feel like there is like a time where it all gets better or anything like that? Like, or do you feel like there is, and I'm saying this from personal experience, I feel like the first less than a year, it was like, oh, this is when you can experience this. But anything past that or anything past 6 weeks, you're like, this is abnormal or things like that. Do you feel like, postpartum can live with you past the early stages of becoming a mom?
Personally, I think so. Like even in my own experience, like I had called my OBGYN to go to ask for a referral for a postpartum therapist because I the anxiety my after those 3 months I was starting to get ready to go back to work, and so then that's when the anxiety was starting to rise, and there was this new thing that I have to do, and I recall the office saying, well, you're 6 months post, like you're beyond the 6 weeks, like why are you calling, why are you, and it's like I didn't qualify, and I was like, okay, well, I didn't have depression before, I didn't have anxiety before, yes, bouts here and there, but it was manageable. This felt uncontrollable, so it's like regardless I need the support. So regardless if we want to diagnose it postpartum anxiety, postpartum depression, or if it, but just support us, right? I don't care what what the timeline is. And I think it's with every new phase, right? So if it's, you going back to work, your child going to school or daycare, or staying with a nanny or a babysitter, those new, every time it's new, right? It creates anxiety for us. It creates this
Mhm.
unknown. So being able to just, go at your own pace, right? I've worked a lot with clients where in preparation to either go back to work or even allowing someone else to watch their child, including their partner, right? Who who helped in the process of all of that. Go sit in your car around the block. You're still close to your house, but read a book, scroll on your phone, go to McDonald's and get a Diet Coke for yourself. Those are the best ones. But go just get used to the idea. You can even just do it for 15 minutes, for 20 minutes. Get used to the idea of being away from your child. Your child also has to get used to
Mhm.
that too, right? And then, but you're close enough that you can come right back if it gets too difficult, right? And each time it creates a little bit of that exposure therapy for them.
Yeah, I remember the first time I was in my car by myself, I was like, it's so
Yeah.
quiet. Where
Yeah.
am
Mhm.
And it's
I?
normal.
And I
It's
think,
normal to be like,
yeah,
whoa, this is weird.
yeah,
Yeah.
yeah. Yeah. And even
I don't think that guilt feeling has ever gone away. You always feel guilty, and I just have to tell myself, okay, this is to help them, because as long as you're helping yourself, you're also helping them, because you're going to be able to do everything to your, full capacity.
yeah, absolutely. And even just, again, taking care of yourself and bringing it back to like a better you is going to be a better um,
Exactly.
person in the family. And I remember the
Mm.
first time I went for my 6 month checkup, which was like after, and for like at the dentist and going and like leaving and being in the chair and sitting there and being like, I can't do anything and I'm not doing anything. And I have all these feelings going, but I was like, I know that doing a routine checkup with the dentist and getting the dental hygienist to clean my teeth is good for my body, which is good for my family, and just giving
That's
myself
good.
that grace of like, it's okay to feel this way and it's okay to do this. So again, creating those opportunities for you to have self-care, and then impacting your oral health, which it then can help your overall health.
Yeah, and I explain that to my patients that I have sitting in my chair who juggle with that. Who I tell them this is what you need, and they're looking on their phone, checking with the babysitter and all of that.
Mm,
And once they take their little minute, I explain to them that, you know, you have to take a step aside and understand that you're really helping yourself, and let them, do what they need to do, so you can, you know, focus on taking care of your mouth. And they worry about how long is this going to take. They stop me in the middle of the treatment sometimes, and are we almost done? And they're because they're worried about their baby, which is totally understandable. So it's kind of like coaching them into just trying to take care of themselves and being okay with being there, even though they're not hands on with the baby,
mhm.
because they it's hard for us as women, as moms, to connect that.
Yeah, and as Lena, I think you put this well, it's like having a trusted support system is also going to enable you to do that. So I've I've learned a lot during this call. So thank you so much. And things that I have stuck with me is, it's okay to slow down. It's okay to set boundaries. It's okay to snack and anyways, but if you want to snack really well, that's going to benefit your health is chocolate,
Carrots.
dark chocolate, cheese, carrots, apples, lots of water, having grace for yourself, having, being able to do those soothing exercises that decompress the stress from your head all the way down to your feet, being conscientious of where you're holding that stress and how that can impact kind of your overarching health and things like that, how your head is handled, and all of your overarching body things. I appreciate you taking the time to chat with me today and talk about this very important subject, and the link between postpartum and oral health. And yeah, I appreciate everything you've talked about today. Anything else on your end before we jump off?
Summer, when for busy moms, right, or busy people listening, when is the best time to brush your teeth? If you
Great
had
question.
So
like only one time in the day, when do you really want to optimize that?
that's a very, very good question. Before you sleep, even though our sleep is broken up, before your longest stretch of sleep is when you want to fully, hopefully, if you could get a flossing in, and then brush, try to get those 2 minutes in of brushing before bed, before you go to bed. That way, the bacteria is gone, and you have your toothpaste and rinse and all of that just fighting it off while you're sleeping, since, that's when your bacteria wants to grow the most. So your mouth is warm and, wet, and it's where an environment where if you have food and plaque in there that you didn't clean away, you better believe that bacteria is going to keep growing and just feasting on, you know, everything that you have. So the best time is before you sleep, definitely.
So while you're up at 2 a.m. with after you have some of your snacks.
I was gonna say maybe just add the sonic toothbrush into your basket of snacks and just like, get a little dry brushing in there while you're sitting there instead of scrolling, just like,
Yeah,
massage from
yeah,
my mouth, and I'm just gonna lean my head back. That sounds like a great
right. And
idea.
sometimes you're like, oh my gosh, I crashed without brushing. Sometimes I just jump out of the bed and I'm like, no way. And I, go do my 2 minute thing, because I know I've seen what can happen in the mouth. So definitely try to floss and brush before your longest stretch of sleep.
Nice.
That's really good advice. Do you guys have any other questions?
No,
No, I
you
don't think
got
so.
this.
Well, again, thank you so, so much for taking the time to speak with me today, being vulnerable and approachable and telling us about your stories. So, hopefully, this will help some other people and remind others to check in with their loved ones and, give them these awesome little tips.
Yeah.
For the viewers watching, if you have any questions, comments, or concerns, feel free to chat or comment in the chat. And also follow us at Burst Oral Care to hear more about our journey to motherhood and the link between, that whole journey and oral health. You can also go to our website and, look at our amazing products and things like that. But Lena and Summer, where can we find more information from you?
You,
So my Instagram handle is Summer Hannah Soof. It's Summer Hannah Soof on Instagram.
Mine is Lena Suarez-Angelino.
Well, I cannot wait to continue this conversation, and hopefully we'll have some other questions and kind of continue from there. So again, thank you so much for taking the time, and I look forward to speaking with you again.
Okay. Thank you.
Likewise. Thank
Bye.
you so much.